But the Medicare.
What are you doing for veterans?
Well, lots of different things,
I see
actually.
your letters, but I don't see any action.
Sitting here, you're right.
Well, I don't know, we've been, I'm on the Veteran Affairs Committee.
I know you are.
We've had,
I asked.
Every day, I know.
we've had quite a few meetings with the different VFWs and,
Are you aware that according to the newspapers, more vets committed suicide than those that are killed in action?
well, yeah.
Well, what are you gonna do about it?
We're
You're
working
gonna
on
get
it.
an appropriation in there? Or just talk about it?
I'm with the Democratic Party. Would you mind signing this?
Well, I don't know what it is, darling.
You want to read it first?
Here, how about, we'll bring it to his attention, okay?
You want to look at it?
Hi, how you doing?
Behind him.
Well,
Yes,
Sir, are you with the media or?
nope.
so I'm not sure where we can actually get done. Well, they're not. That's the problem.
Yeah, okay. That's what I was, something we didn't know, you know.
Thank you.
Go over there.
We had the tendonitis. We can't be honest with you. You didn't get a pre-app? Doctor said that's 7 months. How long's that?
See a whole lot of support.
Well, it's already pending. It's already pending.
Let me give you my card. And, I'm gonna give you Tracy's name. And then she can start a case, make sure that you're getting the stuff that
Yeah, I would call Tracy and explain your case, and she'll open up a case file.
Could,
Take a while, several months.
Can I ask a question?
Well, yeah, call Tracy.
If you want to ask a question, please go through.
She'll open up a case for you.
It's already in motion, pending.
Yes.
Space and to chamber members, but she said there was no real agenda apart from her presence.
right, okay.
So we're hoping for a little bit of a larger crowd.
Did you invite the public?
It was chamber members that were promoting something that we certainly want chamber members.
The general policy for these type of things, we don't allow videotaping, so if you could, please turn the camera off, would be appreciated, because it's just a general rule of thumb for these type of
Can I see the
public
policy?
events. We don't have it written out, but, it's just as general policy for these type of events, we don't do videotaping, so.
Okay.
Okay? Is that,
Well, I'd like to leave it on if I can.
I mean,
For the public
listen,
event.
I mean, we just, for all of our events, it's just what we do.
Okay. So, can leave it on then. Is that okay?
Well, I said it's just a general policy that we don't
Okay.
do videotaping
So it's okay if we leave it on then.
for these type of events.
So it's okay if we leave it on.
That's not, I mean, our policy is that we don't have videotaping for this type of public events.
Okay.
Okay?
All right. Can I stand in the back and keep it rolling?
It's not what we typically do.
Okay. Well.
So, you're welcome to ask Congress my question, but, we don't videotape for
Okay.
public events.
Well,
Okay.
if there's no rules, you're going to go ahead and keep on
It's just our
videotaping.
general policy.
Okay.
All right?
Sure.
GI's got status. More than.
Not on behalf of Dr. Benishek, but on behalf of the Chamber of Commerce, who is sponsoring this event, if you could please turn off the camera. We would appreciate the civility and
Oh, I understand, but I have a right to be here and I have a right to tape. It's a public forum, so.
It is actually a Chamber of Commerce event, and we invited
Well,
Chamber members.
the
but
public's here.
They are, and they are welcome, but as the Chamber of Commerce, we just ask that
Okay.
you would be decent enough to...
Well, since it is a public event and the public is here, I'm going to go ahead and keep on rolling.
Okay, so that's your final stand on that?
Mm-hmm.
That's nice. Okay. Even if it is a Chamber of Commerce event, we could ultimately then determine, because we did invite Chamber members, to ask those that are not part of the Chamber to leave. And that would be unfortunate, because we'd rather have it open to the public on a condition that...
Well, if
the
that
recording
if it comes
stops.
down to that, then I'd like to ask him to leave.
No compromise. Unwillingness to budge.
It's a public event.
It's actually a Chamber of Commerce event again, but we're welcoming the public. But as a Chamber of Commerce event, we'll make the condition that the public is welcome with no video cameras.
All right, well, I just want to get started.
So if you
Welcome
could
to the
please
event.
adhere to that, that would be wonderful.
The Chamber of Commerce
But you're going to choose to
invited
ignore
me
that
here this
ultimately then?
afternoon to have a little conversation with them. And I see some of the public has come. And I see there's a member, somebody's taping me. They're hoping that I'll say something that they can use against me in the election. But I see that you're all concerned about Medicare. So I just want to talk to you about the House position on Medicare. And that is this, that Medicare as it is now will be out of money within 10 years. So there's a real chance that we'll have a significant change in people's benefits unless we do something about it. So the House policy is to change Medicare into a system where you have the choice between Medicare that you have now and what they call a premium support plan, where Medicare will pay money for you to buy private insurance and have a choice between different types of policies. So that's really no different than we have now, except you have a choice between what you have now and a plan where you can pick different types of insurance that suits you best. The problem is that under Mr. Obama's health care plan, Medicare is no longer what you think it is, because there's $567 billion is being taken away from Medicare to pay for Mr. Obama's health care plan. Pardon me?
That's not true.
Yes, it is. So that's the way it is. That's over $100 billion from Medicare for hospitals, $98 billion away from Medicare for nursing homes, and over $200 million away from Medicare for Medicare Advantage. We're simply trying to find a way to keep the system sustainable for the long term. If you have a better idea of how to keep Medicare sustainable for the long term, I would be happy to hear it.
I have an idea.
Why don't we start taxing the people in 2%?
Well, Medicare is funded through payroll taxes,
I'm aware of that.
partially. It's also mostly funded by the taxation on the general fund, the general fund for government. But as it is now, it's going to be out of money within 10 years.
So we need to.
So we need
tax
to
the
change
wealth.
that. This is the policy that we've taken to try to change it.
Well, we don't
And
agree with it.
the people that have studied this plan suggest that this will fix the problem. Well, this is our idea, okay? Like I say, if there's another idea that you may have, then I'd be happy to hear it.
I have an idea. The government was dipping into the Medicare, why don't they replace it with the billions of dollars that they waste? All the billions of dollars that's going someplace else and wasting, put it back into Medicare that they dug out of it. Yep, they took it out. They dipped into it. They
Well,
got billions of dollars
The
back. and
problem
put it
is
back
this,
in.
man, is that there's a demographic change in the country. In other words, there's more people, there's 10,000 people a day being added to Medicare. All right, and right now, there's about 3.5 people contributing for every person that's on Medicare. In 10 years, there's gonna be 2.3 people contributing for every person that's on Medicare. Because the population is getting older. So that's really the problem.
Yeah, but all these young people that are paying into it, into Social Security, out of their checks, Social Security, Medicare, and everything like that, that's for themselves for later on.
No, that money is being used right now by the people who receive Medicare.
Yeah, but who's gonna help them that's
There
coming up
never
that
was
are
there
working?
never was a plan to
People a long time
pay
ago,
in
they took out,
advance.
they took out a long time ago for us getting it now. Now we're taking it out now.
Listen, I've been
for
taking
them.
care of patients for 30 years,
Well-
okay? And a lot of people that I take care of are on Medicare. I'm very concerned that there is not gonna be that coverage there as time goes by. So Mr. Ryan, Mr. Wyden from Idaho, a Democrat, have gotten together with the Wyden-Ryan plan to preserve Medicare. Either keep the Medicare you have now, or have the option for buying private insurance that may suit your particular needs better. Nobody's saying that you have to lose your Medicare. The problem is, under Mr. Obama's health care plan, $567 billion, $500 billion are been taken out of Medicare. And it's gonna lead to decreased reimbursement to hospitals, decreased reimbursement to physicians. So those people may not be around to take care of you,
Why is he taking it out for?
to pay for the new health care plan.
What about the IOUs that
Yeah.
were put in there in place of the money that was taken out of Medicare?
There has been no money taken out of Medicare.
Oh,
Private funds over the years.
No, you're talking about the Social Security Trust Fund. That's Social Security. That's something else. That was something that was removed under Mr. Johnson back in 1965. And that's the same situation, that people who pay in now,
It's been far away.
the people that pay in now are paying for the people that receive now. They're not, that money is not being put away for those people's future.
I have a question on the Ryan plan. We talk about privatizing private companies. How much would a senior citizen get to purchase that?
They haven't even talked about the numbers yet. Okay? It's not a written in stone. It's simply an idea. How are we gonna solve a situation where we have Medicare running out of money within the next 10 years? How do we fix it? So we're trying to fix it by coming up with some kind of a reasonable solution. The way they figure it is that people will prefer to have these private plans because of the fact that you have a lot of different options. Right now, you don't really have any options with Medicare.
Well, people
It
don't
covers
know.
what it covers, and it doesn't cover what it doesn't
Well,
cover.
people don't know what they're gonna get to buy these plans. It's kind of it doesn't make sense. It's like
Well,
fuzzy math.
it's simply an idea. It's not written in stone that
Yeah.
you're gonna get
Well, people
so
hear
much
that-
money.
people
People are worried that they're not gonna get enough money to pay for the insurance.
And people are worried, they get alarmed, and then they
Right.
get over an idea,
Right.
but they don't know what the idea is.
Well, that's what I'm trying to explain a little bit.
Well, you can't explain it, you just said you can't give me a figure. I mean,
Well, because it
really,
hasn't been written yet.
that
It's
doesn't
an
make sense.
idea,
An
okay?
idea, yeah,
It's an idea.
idea.
The idea is keep Medicare the way it is now, or, have them pay you a certain amount every year, like $15,000, or whatever, you know what I mean? And then you get to go out and pick
Pick your own.
whatever type of insurance fits you. You may want to have a high deductible policy with a really high total amount.
If you can afford it, right. Whatever you
Okay,
can
and
afford.
it's supposed to be changed, depending on your income. If you have a very high income, it's gonna pay you less. Okay, and then if you wanna have a different policy, you could put more money into it. But the plan is to give everybody a choice in coverage, and by the fact that you have 30 to 40 different plans to choose from, all, vetted by the government, okay? vetted,
All regulated by the government?
all regulated, to be sure that they're, you
Because
know.
the same house you're a member of, sounds like they wanna deregulate all this, and I don't get
No,
it.
we want to try, they're trying to get more competition,
You're right.
because right now,
If you deregulate, you get more competition, that's the theory, right?
but for example, with my healthcare plan, okay, from what they have at federal employees, I have the federal employees healthcare plan. So I have a choice between about 20 different plans, private insurance plans, that the government has said that you meet the criterion. And I can either choose from a high deductible plan where I pay out of my pocket for the first 5,000 or 10,000 and give me different coverages, or if I want a dental plan or whatever, then I have the choice depending on my personal circumstances, which people may want to have. Personal circumstances may be different amongst people. Certainly people's finances are certainly different. So the way I look at it is, it's your money in the long run. People have been paying in for years, right? So why shouldn't the people have more control over how it's done? And under Mr. Obama's plan with his independent payment advisory board, you know, taking care of Medicare, bureaucrats in Washington are gonna decide what they pay and what they don't pay.
But what about the bureaucrats taking care of all those plans? Who's gonna see
But at
to
least,
it?
you know, at least if you have a choice of 30 different plans, and you
Yes,
don't
right.
decide this guy over here is not giving you a good deal, you can
Yeah.
quit him and go to somebody else. Just like if you have, with your insurance now, you get an insurance agent that doesn't treat you right, you can fire that guy and go to somebody different. When you have the government, one person telling you what it's gonna
One
be,
person is not telling.
well, this 15-member board with no appeal is not going to be able to, you're not gonna have any appeal
It's
from
been
that.
working so far, Medicare's been working, so. why
Exactly,
don't
but
you
the
fix
problem
it?
is that it's out of money.
Oh, yes, then.
That's the
then-
problem, you have to
Well,
consider that.
Make it worse by putting out up to 40 other plans.
We're just trying to find an answer to the fact that there's fewer people paying in, and there's more people getting on. And to try to find a way to do it better, you understand, with less waste and more options for people. As far as I'm concerned, it's your money, you should have the choices as to how to spend it.
The options, I want it the way it is right now.
Then you have that option, that doesn't change.
Oh, okay, you're trying to do it though.
For how
No,
long?
no, that's not the plan.
Yes,
The
you
plan is
are.
have,
Your Ryan plan is changing it, isn't it?
well, no, the
Yes,
Ryan
I know.
Wyden plan,
That's the one you're for, and I'm not. I'm for keeping it the way it is.
well,
And
that's
what we're hearing.
That's what I'm saying though, is that we're not taking it away. We're giving you the option.
We don't want it.
Yeah.
Well, then don't get it then. That's completely, that's part of it. You can either take it or not.
We're here to tell you, as our congressman, to represent us, because we don't want that.
But
We don't
that's
want
not what we're
those
saying.
options.
We're
We don't
saying
want-
that
we
you have the
tried to do
option.
that with Social Security, give everybody options. Nobody wanted the change in Social Security, and this similar.
See, something has to change because the money will run out.
Well, yes, you can do other things.
Congressman,
Raise taxes.
why does something have to change for us who have paid into the system for 30, 40 years, who are the working force of the world?
Right.
But the rich people, the 2%, they don't have to. And the oil companies that we're
nobody's talking about-
already funding with our $4 a gallon, they get their breaks.
Well,
When
nobody's
do we
talking
get
about,
a break?
the only thing that we're talking about is this.
There you
For
could get
those
money.
55
The oil
years of
companies.
age or older, no changes. Okay, but the problem is, there already has been a change in Medicare because Mr. Obama's health care plan took $567 billion away from Medicare.
I understand that, but you're pretty sure you're gonna get rid of that anyway in the Supreme Court.
Well, I
So
don't
let's
know
stop
what's gonna
talking
happen.
about that and answer my question. Why a Congress that mostly ran on family values is turning its back on its grandmothers and grandfathers and saying,
I don't see that,
y'all
Dawn.
go on your own. If you're 55, you're 50 years away from retirement, go out and build up a little nest egg right now. Where are your family values?
That's not what I'm saying at all. I'm saying if you want to stay on the Medicare that you can do that.
If you're 55 or older, but
No,
there
if you're
is not
55 or
enough
younger
time.
as well.
There is not enough time if you are, because I know, I started over at 45. At
What I'm saying,
45 to
ma'am, is this.
65, it's not enough time.
What I'm saying is this, if you're 55 or older, the plan changes nothing. Okay? If you're 54 years old or younger, you have the option of staying on Medicare as it is, or you have the option of going to this premium support plan.
You're not answering my question. Why does it have to be this way and we can't tax the people
We're trying
that
to
we
find
are
a way
already
to
funding
save
with our
Medicare?
hard-earned money just at the gas tank? Why aren't we taxing the people that Reagan taxed, but you guys don't want to tax them?
We're talking about two different things now.
No, we're not.
talking about
We're talking about
Medicare.
running a government and taking care of its citizens. And I don't hear you doing that. I hear you finding ways to keep the rich richer and the poor.
Hey, I
well,
think
we'll find a way
everybody
to
should
get
pay
them
their fair
by.
share of taxes.
Really?
Yeah, where you do
Yeah.
that? That's allowed. How about the oil companies? You're not for taxing them, are you?
Yeah, sure, they pay taxes.
Oh, yes, but not enough.
I don't know, they pay about 40% of their profits in
Oh,
taxes.
yes, oh, yes, that's why I guess.
Well, it's the
I
truth.
think they get all that back in
Yeah.
revenue share, well, not revenue sharing, but they get all that back in the government, giving them
Yeah.
money.
No, the
I
government
think
doesn't
it's
give oil.
Exxon
You know
paid
what?
nothing.
The government does not give oil companies money.
There are
Tax
no government
breaks or
subsidies for
There
oil.
are no government subsidies for oil.
And how's it they pay
Government,
taxes?
oil, what you're
That's a
talking
lie.
about, huh?
That's not true.
Yes, it is.
Oh, it is not.
Well,
The government is funding.
they do not give the oil
subsidizing-
companies money.
Yes,
Okay,
you
okay.
say that.
Oil companies take the same tax deductions that any manufacturer takes.
Oh,
It sounds like the theme here is, how are you gonna fund all this? They're talking about raising funds to cover Medicare. I think that's the whole theme here. But it doesn't seem to be a plan for that. They wanna privatize
Well-
it, take care of their private insurance companies,
well, we
who
do.
contribute to the campaigns. We all know what's going on, who does all that, but these folks are looking at ways to fund Medicare. They think that nobody's looking at that.
Well, we're looking at all kinds of different things. If you come up with an idea to save Medicare, I'd be happy to hear it, okay? We came up with an idea, all right, in the House, all right? We passed it in the House as a budget.
Yeah, we didn't
Okay.
like that you did that.
Let me just finish. So that's our position, all right? So we're waiting to see what the Senate will do. Okay, the Senate has a Democrat majority, the Democrat leader, and we want to see the Senate come up with a budget. Okay? But they don't have a budget. They don't have a plan. We have our budget, which includes this plan for Medicare. We would like to see the Senate have a plan. What's your idea? Pass something in the Senate, and then we will come together with a conference, and then, maybe work out the differences between our plan and their plan, and then move forward. But it's hard to argue with someone when they criticize what we've done, and I'm not saying that it's a perfect plan. Okay, I'm not saying that it's gonna be what the final result should be. I'm saying this is the starting place to talk about the problem, because there's a problem with Medicare, it's gonna be out of money. Let's talk about it. Let's find a solution. So this is the solution we came up with. So if they would have a solution, I'd be happy to hear it. But if they haven't said anything, they just criticize what we've done.
Sir.
It's hard to,
Did you listen?
but I just want to finish my thought. It's hard to negotiate when somebody says, well, your plan is bad, your plan is bad, your plan is bad. Okay, well, then what's your plan? Well, we don't have a plan, but your plan is bad. So you understand what I'm saying? I'm not an expert at this, okay? I've been taking care of
I'm not either.
patients for 30
I'm not
years.
either.
And I'm just trying to find a solution. I'm not trying to win any points or be a good Republican or anything like that. I'm just trying to find an answer, because this is why I ran for Congress in the first place, is that there doesn't seem to be any answers coming from Washington. And I don't pretend that I know everything.
Well, the answer,
Yes.
oh, sorry, go ahead.
I just want to let this fellow.
I have a surefire guaranteed way of funding Medicare. That is to remove all of our representatives from any government insurance, put them on Medicare, make them purchase their own subsidiary insurance, and Medicare will be funded instantly. Be no problem at all. There'll be money in it coming up over the edges, okay?
I wish that were
Second,
true.
say it's true.
Well, there's
You
only
think all the
400.
senators, congressmen, make you put them on Medicare and no other insurance?
I want Medicare.
Yeah.
I paid for Medicare.
Sure, yeah, but you're also on a paid government insurance program, you're a very nice man.
Well,
But
I
the other-
pay, just the
one other
same as
thing-
anybody on the federal government is the same
Federal
insurance
government,
that I
there you
have.
go.
But we're
They put
not-
them all on Medicare, period. Now, another thing is it's President Johnson and President Obama, Mr.
Yes.
Benishek,
Yeah.
okay?
Not Mr.
Yeah, that's right. That's right.
Okay.
You know, healthcare costs keep escalating and there's not enough money there to fund it. How are we gonna fund it and what will happen to benefits? I mean,
That's the biggest problem with healthcare in this country, is that it costs so much.
That's
Right?
why we need
And
Yeah.
that's, I've been taking care of patients for a long time, all right? And the problem is that, one of the problems is, for example, is this. There's not many places you can buy health insurance in the state of Michigan, okay? There's only a few companies. Biggest company being Blue Cross, which controls about 70% of the business in the state of Michigan. There's a lot of regulations that limit the ability of people to sell insurance in the state of Michigan. You can't, for example, buy health insurance from a company in Wisconsin if you're in business in Michigan. But you can buy car insurance for a company in Florida or California. You can buy car insurance from anybody. So why not open up the insurance business so that you can buy your health insurance from any company in the country?
But that's not gonna change the cost of.
Well, sure it is, if there's more competition. Right now, there's only 3 people that are providing it.
Yeah, but that's the theory behind it, is that it's gonna drive down costs, but
Yeah.
I think history shows that it probably, costs will continue to go up maybe 7.5% a year.
Well, I don't know what I know is that usually if there's more competition in an industry, the cost goes down.
Well, if you look at the auto industry, though, the insurance, it's gone sky high, and there's all kinds of competition, you just said it yourself,
Yeah.
and it wouldn't work, I mean, it doesn't work in the auto industry, auto insurance.
Well, I think in car insurance,
Michigan's
having a
highest
different
tax.
option, gives you much more
Well, you got
choice as
tons
to
of
your
options.
coverage.
You're right, in auto insurance, tons of options,
Yeah.
but the cost is,
As soon as you put a profit motive in there, that's gonna take 15% right out of healthcare. I mean, for profit, people have to make their profit, and I'm not opposed to that, but I'm saying that's money that's being taken out of healthcare services and goes to a private company. But my biggest concern is how is it gonna be continued to be funded and receive the same level of benefits that we're getting now?
Oh, I can understand your concern there, but, I don't really trust the government to do it efficiently either. I think that you can do things, much cheaper in the private sector than you can in the government. That's why, oftentimes they'll contract different things out.
If you go with the voucher system, then your out-of-money pocket for the premium is gonna probably go up.
Well, that's the point of having the option that we're talking about, okay? I mean, as I understand, nobody's talked about how much, everybody's concerned that, it's not gonna be enough money to pay for any insurance. But you have the option of staying with Medicare that you have now. This is for younger people. Have the option, or staying with the same Medicare, or going to a private insurance company if you think it's better for you. I mean, what if it turns out to be better for you? You could always switch, you can switch back and forth, so why wouldn't you take the thing that was working out best for you? We're not trying to, impose it on you, we're giving you a choice. I don't see really the downside of it.
Mr. Benishek, these problems are so deep that I don't even know where to start, but I just wanted to make a couple comments. I am totally unconvinced when people say that government is the problem. I mean, how can you run for government and want no government? I mean,
I don't want no government, but I want
understand.
less government.
Well, I'll tell you what's happened from our side. We have so few workers, governmental workers anymore, that everything is just spread thin and doing way so much. A great many of your policies are to get rid of regulations. I mean, absolutely, I feel a lot of your policies are to control. They are not to free people. I mean, what about all the money that people invested, that Wall Street gambled with, and nobody saw it? Nobody wanted to regulate them. Nobody wants to punish them. We don't get anything back. That is a horrible thing.
Did you lose a lot of money in Wall Street or something?
Yes, we did. Everybody did.
Everybody.
Everybody did. When did everybody start investing? And the whole thing about in business, the way it's being run now, is competition. I agree, competition is good, but it is not all there is. And competition run wild is very destructive because it's the meanest, the biggest, eat it all. You go to our grocery store, almost all the groceries on all the shelves are owned by 5 big, greedy giants. They own them all, and they put different names on it. And so part of the problem is cooperation. So when people do not acknowledge the other party on both sides for the really good things they have just done to hold things together, I lose faith in all of you. I mean, Obama has done so many good things. There are Republicans that have done so many things. The insurance across the state, one of the things is get the government regulations out. Get the government regulations out of a great deal of things, like our food, like our water, like our air. And so these aren't important. To me, I don't see both parties absolutely protecting the commons. Our earth is being ripped apart. People are sicker than they've ever been with our very smart scientists and politicians. So you have to start hearing.
I don't know if I agree with you with that. I think the life expectancy of Americans has been going up for decades.
I grant that.
People live longer now than they ever have.
Maybe live longer.
We have the
with-
best healthcare system in the world, I
That's
think.
not true.
So,
How can you say that?
Well,
How
I'll
can
tell
say
you-
that?
I've been in it for 30 years. I think I have a pretty good
What about the lifespan?
lifespan is higher now than it's ever been.
What about the
Yeah, but what
quality
about
of
compared
life?
with other countries?
Other
that
countries,
have
they
health?
all
We have
are better.
we have one of the highest lifespans in the world.
Well, I just want to end by saying
Well, you have to
cooperation
show me
is
an
important too.
Well,
Right
if you
now, for example,
Put your heads together.
in Britain,
Yeah,
the time that if you're diagnosed with cancer in this country, you have a 75% chance of living 6 years.
Okay, if
If
you
you-
get to the
if you're in
doctor
Britain,
and you care.
You do not have that same chance. You have like a 45% chance of living 5 years. If in Canada, it's like 60%. We have the highest.
Then why do
we
they have a longer lifespan in those countries?
I don't think that they do.
We do.
They do.
Yes,
How
they
could you
do.
not know
They-
that? You're a medical doctor.
Yeah,
They
it's
do.
true. Yeah.
I don't believe that's true.
Scandinavian countries?
You look up your records on lifespan.
Go on.
What about the power of the pharmaceutical companies?
Well, I
Doesn't it
appreciate you
worry
coming
you?
down and asking me these questions. Thank you all very much.
Yeah.
But if you really want to know my position on a lot of different issues,
I have that.
then I would go to the website, benishek.house.gov, and see where I stand, rather than taking somebody else's word for it.
But we don't,
I've
we
been-
want you
Thank
to
you all.
hear our position, Congressman.
Well, there should be certainly something for those. Thanks for coming down, I appreciate it. Thank
So
you.
check your lifespan. You have to get that straight.
Not regulated.
Where's
How they tried to.
They're
trying to shut down the Prescott power plant. It's the only power plant in the UP.
I know.
Oh, we gotta do something with those guys. They are just. Sorry, but yeah, we've just been dealing with their new regulations on no more coal plants. A country that is the Saudi Arabia of coal. Of course, the Chinese, who are building the coal plant a week, are going to say, hey, send it to us, we'll use it.
I know it's frustrating.
Oh my goodness, it's terribly frustrating because it's jobs. If you can't provide low-cost energy for folks, you're not going to have manufacturing jobs. You're not going to have it at all. And we're very exercised about this issue. We know it needs to be done, and we think.
Well, I think that we
some
should have
changes.
reasonable regulations.
Hey, who are you, buddy? And why are you taking my picture without my permission? Who are you? Who are you, sir? No, you don't know who you are?
I've got a right to be here. You know who you are.
You certainly have a right to be here, but you have no right to take my picture.
All right.
I'm telling you, you can't.
Everybody gets.
Take your pic. Don't take my picture. Who are you? Who are you?
Excuse me, sir.
No,
It's
no.
not-
Who
not-
are you,
not
sir?
appropriate.
I'm sorry. Who are you? What's not appropriate?
Well, my name is.
You're not. I'm sorry. What? What's your name and who are you with? Are you with the chamber? Are you with the chamber? Eric? Where are you from?
From Sault Ste. Marie.
Sault Ste. Marie. And Eric, what do you do?
Well, I'm actually a workout for the Michigan Democratic Party.
That's what I thought.
Nice to see.
Because, you know, Michigan Democratic Party reaching their wallet, money to take care of the fuel, you know. I'm back to burning wood. I can't afford propane. And, you know, the oil companies have a lot.
Can you call this number and ask for Tracy?
Okay.
Then tell her the problem with the propane, she can get you in touch with some people maybe who will help you out.
I just handed
Well, you probably need to go through the Public Service Commission, the state law.
What I'm saying is that if you call that number, then she'll be able to help you.
Well, they got some political things like they can't build across a railroad track. And that's a lie that they sent. I think it was about 20 years ago. I took a petition around to the people, and they signed it, you know. But the oil company wouldn't go for it. And they have a gas generating plant just up from the road from where I live. It's about 3 blocks away. And people in Brimley are getting natural gas. Some people in Kinross are, but it's kind of a spotty thing. And basically a payoff. Another.
All right, thanks.
Thank you. See you again.
All right, thank you. See you guys.
Thanks, guys.
Thank you. Thanks, guys. Yeah, you did well. Okay. I got it.